Back to the physical classrooms for the nation's students, with school plans set to reopen their doors on Monday, April 19th. In a statement on Thursday, the ministry said that, quote, of paramount importance are the health and safety of students and staff and support staff, unquote. Chief Medical Officer Dr. Sharon Belmar-George points to the successful track record of other sectors that have opened their doors as testament of the move to reopen schools.
In St. Lucia, children under 18 years make up to 9% of cases to date. Generally, this age group presents with mild or asymptomatic disease. There have been no deaths to COVID-19 in this age group in country. Current evidence suggests that children are less likely than adults to be transmitters of the disease, and child-to-child transmission is uncommon at schools. Schools have not been associated with significant increases in community transmission.
Dr. Belmar-George says many deliberations were held to ensure the health and safety of students and faculty.
The following have been recommended: the psychosocial support when needed to address fear and anxiety, medical support provided through the support of the community wellness centers, the availability of safe, effective vaccines to all staff of the educational sector, ensuring school-related measures are integrated and support measures implemented at the community level, the provision of accurate, updated information to staff and parents to counter misinformation, the training and sensitization of all staff members, and the management of stigma and discrimination at schools, the full usage of the education sector continuity plan at every school, which clearly highlights all of the protocols and algorithms in managing any issues at the various schools.
Some institutions will adopt the whole school approach based on physical infrastructure and population. However, 34 schools will operate using the alternate day system. The Chief Medical Officer says the lingering concerns of parents are not lost on officials.
But we cannot act out of fear. We need to use the assessment of our local situation and ensure that the necessary measures are in place to move forward. Additional factors that are also considered include the harm that may occur due to school closure, the risk of the non-return to school by students, the widening disparity in educational attainment, limited access to meals, and the need to maintain schools at least partially open for children whose caregivers are essential workers. According to the World Health Organization, there have been few COVID-19 outbreaks in schools. From the studies conducted, the transmission was primarily related to social events related to schools rather than transmission within classrooms.
Educational institutions will operate from Monday to Friday based on the established school hours, but the ministry says that the authorities are not permitting mass crowd gatherings at this time.
We continue to work collaboratively with them, and it is very important to tell the general public that it is based on their guidance that this date has been proposed. The discussion continues. The health and safety and well-being of all of our stakeholders, our children, our teachers, our support staff, administrators, the wider educational fraternity remains paramount to everything that we will do.
The education sector is looking to make a full recovery after setbacks inflicted by the pandemic. Solange Alfred, HTS News Force.